So Caroline Ellis is one of our lead Admiral nurses in Cornwall. Pleased that they're able to join us today. And Caroline and the team are going to lead a care and share event. I'll let the team come up and talk about what this is going to involve. This is new to us at the conference, so bear with us. We haven't tried this before, so hopefully it's going to be good. Are you ready?
Okay, thank you very much. Good morning, everybody. I'd just like to take this opportunity to thank you so much for inviting us to be here today. And it's an absolute privilege to meet so many wonderful colleagues and people living with dementia and their families. So thank you all for coming today. I'd like to introduce myself. My name is Caroline Ellis. I am the service manager of the Integrated Admiral Nurse Service. We provide support, emotional support, guidance to families and carers who look after people who live with a diagnosis of dementia. We've got the most amazing team. We've got 3 Admiral nurses in Cornwall. We don't just support in Cornwall, we also support in the Isles of Scilly, and we actually do have someone here from the Isles of Scilly today. So hi to the Isles of Scilly gang. We're here today to actually talk about the Care and Share event that we run. There are 2 a year, they run every 6 months. But before we go into that, I'd just like to give a bit of context of who are the Admiral Nurse Service, what do we do, so that you understand how the Care and Share events sort of work. We run the Care and Share events, but we also run the Supporting Ahead programmes, and we also chair the Carers Corners in Cornwall, which hopefully you've also seen. So Admiral Nursing actually started from 2 sisters who used to look after their father who had a diagnosis of dementia. Their father loved sailing and was very much part of the maritime world, and his nickname was Admiral Joe. When the sisters were caring for their father, they noticed there wasn't any support for them, the carers, the families who were living it every day. So when their father passed away, they decided that they were going to set up a whole sort of charity, and they set up Dementia UK and the whole ethos of Admiral Nursing after their father's nickname, Admiral Joe, which is why we're known as Admiral Nurses. So I love that story. The Admiral Nurses are here to support the carers and the family members. So so this is our team. So you can see myself, and we've got Sarah. Do you want to introduce yourself?
Yeah. Is that working or this working? I don't
Yeah,
know.
that's
This
working.
one. Hello everybody. My name's Sarah. So I'm the Admiral Nurse that covers North and East Cornwall predominantly, but we do cover the whole of the county. So it's a county-wide service. And I just want to give a little bit of a sort of run through of the day of the life of an Admiral Nurse. It's an incredibly diverse role, so there's no sort of no 2 days are the same really. So as an Admiral Nurse, it's my role to enter the carers' reality, work with them and supporting in their lived experience and what they're going through, and meet them where they're at that particular time and stage in the journey. So as well as holding a clinical caseload, we are very sort of public facing. So I'm out and about attending MDTs and meetings on all the local community hospitals that I cover, as well as the acute inpatient. So Garner Ward, for example. Is there any Garner Ward staff today? Hello, nice to see you. Nice to see a smiling face. So I attend Garner Ward MDTs on a monthly basis, and I might speak at the MDT or link in with the staff there about particular cases that have arisen. So supporting the carer throughout the inpatient journey, talk them through sort of like the sectioning process, what to expect, and support them in, the discharge planning, because that can look very different for a carer, looking after somebody with a dementia at home and then goes into a place of care on a permanent basis. I attend the sort of the CATU. Demelza and I share supporting the CATU MDT, so we attend that on a weekly basis. So we're very sort of visible. Also the same day emergency care, because obviously the CATU and the SDEC are intertwined and interlinked with each other. Admiral nurses were a vital link for families into getting them involved in other services and what's available to them. And we're also a source of education and support to our dementia nursing colleagues as well. That's just a little bit of a flavour. Like I say, no 2 days are the same in the Admiral nursing world.
Thank you. Jo, do you want to introduce?
Yes, hi everybody. I'm Jo. I've just joined the Admiral Nurse team here in Cornwall, and I'm going to be covering the west of the county, and that'll be linking in with Campbell and Redruth, St Michael's Hospital, West Cornwall Hospital and Helston Hospital. And I have already visited a couple of those, so hopefully we've got people from those hospitals here today as well.
Hi, I'm Demalza. I'm the assistant practitioner for the team. I support with safe discharge after the nurses have done their interventions. I also do quite a lot of support and advice, and out and about visiting memory cafes, and predominantly help with the Carers Corner as well. And a bit of a shout out to Hayley Townsend's our amazing other Admiral nurse who's actually sunning herself this week.
Yeah. Right, okay, so this is the best bit. I'm really excited to say that actually our Care and Share event that we run has become a finalist for the Dementia Care Awards this year. So I'm really proud of this event. And this has actually happened because of everybody here in this room. We all, on this side here, all the stands, all the services, it would not work without their commitment. So big congratulations to you all. Thank you so much. So what is Care and Share? Where in my role, what we noticed is that sometimes us as professionals do not always know what each other's roles are, who we are, what do we do, how do we actually refer into your service. So therefore, we have set up the care, so we all care, that share what we do. We run them twice a year, every 6 months, and we invite every service and organisation that we can think of. So if you are out there listening and you're thinking, oh, I'd like to get involved with this, please do let us know, because we are so friendly, I promise. And it's about inviting every colleague, professional in Cornwall and the Isles of Scilly who work in dementia care and want to learn more about what is out there in Cornwall. And we have guest speakers. We've had some incredible guest speakers and presenters. And then we have a sort where we also then have stands and sort of mingling session. So what we're trying to do today is demonstrate how it works. So it's going to be a little bit hit and miss, but hopefully you'll get a gist of how it works and you enjoy it. We're going to have stands come up, and each organisation have 50 seconds each to explain what their service is. So obviously it's going to be a bit difficult. And then after that, we are going to have a break. And in that break is when you get the opportunity to meet all the stands and all the services. And then, this is the best bit, what I'd like you to do is choose one person from each table to be your representative to come back and use this mic. It's called the open mic, where you can actually talk about a service or organisation that you have met in your break that you did not know about before, and share it with everybody. Right, I'm just going to show you a short video of how the last one that we held in December. Like Demelza said, our next one is on June the 27th. And that's at the Knowledge Spa. Places are filling up, but we've still got space if you'd like to book your place. Here we go.
Hello everybody, I'm Sarah, I'm one of the Admiral nurses. I'm here today at our Care and Share event, and it's going incredibly well. We have a huge amount of people in attendance, both audience members and stall holders. The reason I love this event that we host every 6 months is because everybody comes together in the same space, the same commonality of to sort of supporting those with dementia and the carers, and just sharing best practice really, and networking and finding out about services that people wouldn't otherwise have known about until they have attended today's event.
Hello, I work for the Alzheimer Society. I've just come along today to see what all the other groups do and how I can link up with them to do my role and help people with dementia. I'm a dementia advisor for Mid Cornwall.
As a student nurse, it's really important to interact and network with people, so I found today really interesting to see what all the different parts of the NHS do, and should hopefully help me in the future.
So my name's Sophie, I'm the Community Engagement Officer for Shared Lives South West. We're a social care charity, and I'm really glad to be here today because it's so interesting to hear the key speakers. They've been fascinating, the sleep therapy especially, and it's also such a good chance to network with other care providers. You know, the research that's going on in Alzheimer's and dementia. And yeah, I'm really pleased to be here today.
Hi, my name is Jo and I'm a staff nurse at West Cornwall Hospital in Penzance. 4 of us have travelled up from the ward today. We deal mainly, it's an elder care ward, general medical, but we deal with a lot of patients with dementia. I'm actually the dementia link nurse from the ward, so have a passion for dementia. But we find coming to these events really beneficial because we can sort of talk with other people that have got similar experiences, or they can give us experiences that have helped. In general, we've been to a few before and they've always been beneficial that we can take this information back onto the ward. I work alongside lots of other staff nurses that we try to give as much information to the patients' relatives as possible. We work alongside the Admiral nurses at work who are really beneficial. So generally, all in all, I think this would be a very beneficial day.
My name's Vicky and I'm a physiotherapist in CFT and a researcher with the University of Exeter. And I'm here today because sometimes it's really hard working in the field of dementia to keep up with what's going on and know who is who. Sometimes if you try to find the information on the internet, it can be overwhelming with the amount of results you get. So this is a brilliant way to make new networks and connections.
Hi, I'm Nicola Robrys. I'm a dementia advisor for the Alzheimer Society. I've really enjoyed the event so far, particularly the talk on sleep. I just think it's really positive to learn how other people work, what support's available so that we can improve our service. And it's just great to meet new people, network. Yeah, really grateful really for the opportunity.
Lovely, thank you so much. Can I just point out that the Care and Share event is for professionals and services themselves, but the Supporting Ahead programme that we also run is directly focused for the carers and families. So it's the same sort of programme, but we have one for professionals and one for carers and families. Okie dokie. So let's get to the best bit, shall we? I'm going to welcome each service to the stage, and everyone here has got a stand. We would love you to come and visit the stands and to find out about each service that's here. And can we just, every time someone comes on stage, give them a really good welcome. So thank you very much. Let's go to the first one.
Oh no. Typical I'm first. Oh no. So I work for Cornwall Carer Service and my name's Kate. So what we do is we support those who care. So we are commissioned by Cornwall Council. What we do is we get referrals from Cornwall Council. We get them from everywhere, hopefully. And what happens is those carers that come to us, they usually want advice, support, have a conversation, what's going on for them, and during that time we're having a generalised conversation. How's things going for you? Are you eating? How's things for life? Are you getting a chance to be able to speak to people and getting out? And how's a relationship with the person you care for? And we go through all of their life and all of their story and try and concentrate on what we can do to support them, if not just being a listening ear. We give them as much information as possible. We refer them on to services. And now my time's up, but please come and speak to me. I'm here and I'm quite friendly. Anyway.
Hello, I'm Nicole Mitchell and I'm a massage practitioner who specialises in treating people who live with dementia. I go and visit people in the community, but I also have the little massage clinic, which is based in Scoria. About 14 years ago, I developed the first course of its kind in the UK, which is all about developing relationships through therapeutic touch for people living with dementia, which went on to get an award. And I've since developed an advanced course, and 2 weeks ago, I celebrated a third course, which is aromatherapy, so again, connecting through senses for persons living with dementia. And it's all about basically, I suppose, oh gosh, I'm struggling now. It's about basically building relationships through senses. So I have a stand up in the Anthony Room. Thank you.
Hi there. I'm Kelly Gilmore, aka the Sleep Mentor. I'm an integrative therapist based at Falmouth Natural Health Practice, and I specialise in sleep support, and I deliver education classes and workshops around the county, including at memory cafes. I support people into gaining and maintaining healthier sleep habits, and I'll be delivering a workshop this afternoon at around 3 o'clock, 3:30, yeah. But also explaining the vital importance of good sleep, particularly for people living with dementia and for those caring for people living with dementia. You can pop up to the Anthony Room up there and come and see me and chat about all things sleep and how I might be able to help you.
Thank you for asking us and me a few moments ago to talk. So I've written a few things down. Hi, I'm Natalie Swan. I'm the palliative and end-of-life lead for the voluntary community and not-for-profit sector at NHS Cornwall and Isles of Scilly Integrated Care Board. So end-of-life is a priority in our system, as is supporting people to live well, including people living well with dementia and frailty. So there's a real focus on this within our system. And dementia is a life-limiting progressive condition, so by definition palliative. But there's a problem because that's often not recognised as such, and that means that there are clear inequities in experiences and access to palliative and end-of-life care. And I feel really passionate about that and also about dementia. Thank you. So talking more about it is really important, but particularly where we have a life-limiting condition. And I've asked Hayley today to come along and talk a little bit more about planning for the future. Thank you.
Hi, I'm Hayley. I'm a registered nurse. I work with Cornwall Hospice Care. I'm clinical and I'm working the education team. I'll be doing a talk later, but we'll be talking about advanced care planning and planning for the future. So I look forward to seeing you later. Thank you.
Morning everybody, my name's Laura. I'm a research nurse with Cornwall Partnership Trust. So just to let you know, we've got about 20 studies in Cornwall that we're currently recruiting participants to. They range from mental health studies, physical health studies, dementia studies, but also my personal favourite, studies with carers. So we have some interventions that you can sign up to, and then they get evaluated by yourselves, so you can provide feedback, let us know how you feel about taking part in things like that. So if you're interested in coming along, taking part in research, finding out what we've got available, come and see me at the stand. So we've got research opportunities for yourself, for your loved ones, and for your patients that you might want to refer to. Thank you. Thank you.
Hello, I'm also Laura. I'm from National Energy Action. We're a national fuel poverty charity. Our main aim is to make sure that everyone can afford to live in a warm and safe home, because we all know that cold homes are not safe homes. We do this by providing energy and benefits advice to householders. We also train frontline workers in energy, giving energy advice and recognising fuel poverty and carbon monoxide awareness.
Hi, I'm Vicky Brown. I'm a semi-retired old age psychiatrist, and my stall downstairs is about lifestyle medicine and how we can use the principles of that to reduce the chances of people getting dementia, working on slowing dementia down. But when I'm coming to the Care and Share event, I'm also going to talk about my experience as a carer and what I've learned as a professional and what I wish I'd known before I'd started caring, because I learnt a lot. Thank you.
I'm just going to time myself, bear with. Hi, I'm Kate. I'm from Memory Matters. We are an organisation that works across Cornwall and also in Plymouth. But in Cornwall, we provide cognitive stimulation therapy, which is a fun, peer-led group where we meet in Weybridge, St Austell, Liscard and Newquay. We share thoughts and feelings. David, we share opinions and not facts. We have some fun and we provide a 15-week group, which is followed by a next step. We are also part of the amazing Dementia Together team, where all of our facilitators and co-facilitators are also dementia support workers. So I'm going to hand on to another one of our team.
Thanks, Kate. So we're here today from Disability Cornwall. I didn't introduce myself. My name's Romy, but we're here today from Disability Cornwall. We are a values-based, user-led disabled people's organisation with a mission to represent, include, support and empower people living with a long-term health condition and disability who live in Cornwall and the Isles of Scilly. We're here today to talk about our great work around our various dementia services, including being the lead partner for West Cornwall in the Dementia Together Collaborative, and our work with the Cornwall Memory Cafe Network as well, and our dementia education content and podcast host, Anna, is going to do a session later on as well. Thank you.
Hello, I'm Kirsty and I'm from the Alzheimer Society. I am working alongside our partners in Dementia Together with our amazing dementia support workers. You all have your leaflets on the tables for our service and how you can refer in. And we work alongside the primary care dementia practitioners to support people countywide with dementia. Please visit us.
Good morning, my name is Clive. I'm supporting my colleague Joe. We are from Mediquip. I was intrigued to know what was going to happen at the end of 50 seconds, but there's a sign down here that says your time is up. We are an NHS commissioned service. We provide the physical equipment that's prescribed by medical professionals in Somerset for the NHS. It's a free service. Come and see us. We've been demoted to the dungeon downstairs. Come and see our stand. So what we do related to dementia is alert equipment, safety equipment that would help people with dementia, but also those with physical difficulties as well. So it's the NHS service for community equipment, and it's myself and Joe downstairs.
Hello, my name is Paula. I'm from Cornwall Fire and Rescue Service and I work as a community safety advisor. So part of my role is to go into people's homes and we can provide what we call a home fire safety check, and that's for anybody with an increased risk of fire. So it does include memory issues, mobility issues, but also drug and alcohol misuse, hoarding, anything like that. I'm downstairs in the basement, so if you want to come down and have a chat, we can look at how to refer in, who you want to refer in, and how we go about doing that, and then we go out and do those visits in people's homes. Thank you.
Morning, everybody. My name is Karen. This is Stacey and Megan, our student nurse. We are with the Countywide Dementia Liaison Service. We've also been demoted to the dungeon as well, so please do come down and see us. We work within the county of Cornwall alongside the Dementia and Older People's Mental Health Services, and we reach into and also community hospitals supporting living with advanced dementia. So please come down and see us and we can tell you all about our service and the love.
Hi, I'm Gail. I wasn't aware I was going to be doing this, so I'm going to have to wing it and picture you all naked because I'm incredibly nervous, okay? I'm from the FILO project, and we provide small group daycare for individuals in a host's home. We have various groups across the whole of Cornwall, and we've been around for about 11 years, but now for about 2 odd years in Cornwall. And I'm going to leg it now. So I'm off. Thank you.
Hello. Oh, cripes. Sorry. Hello, everyone. My name's Claire. I'm part of the Sensory Trust team. Creative Spaces is our inclusive dementia project. It's based on evidence that health and well-being of people living with dementia can be significantly improved with contact with nature and the outdoors. We have 9 regular walking groups throughout Cornwall, from Newlyn to Bude, and we bring together people living with mild to moderate dementia, their families and carers, and we provide positive opportunities to walk, take part in nature activities, and meet other people in similar situations. The groups are free and run by our lovely volunteers. The walks are accessible, an amble, not a ramble, and they take place in the local area and are chosen by the groups. Creative Spaces is about supporting people to live better in their communities, fostering independence and promoting health and well-being. And we're behind the coffee on the right.
Hi, I'm Emily Pearmain. I'm here from the University of Exeter and with my colleague Joanna. So we're on the stand promoting a new network which is called Spin Dementia Network Plus, and it was funded by the UK government, and it focuses around research, involvement and innovation to understand more about brain health and the causes and risks around developing dementia. So we've got various research projects that we would be happy to talk to you about, and the different aims and objectives of that bit of research. And we run quite a number of different events, and we want to particularly promote our conference, which is coming up in July. I'll hand over to Joanna.
We're also here to not only, of course, promote participation in research studies, but also form a collaborative network where you can actually design and plan studies that you actually care about alongside researchers.
Wow, all I can say is what support we do have in Cornwall is just phenomenal. So thank you to everybody who's come up on stage and explained who you are, and it's now your chance to mix and meet everybody. Yeah. So this is your chance now. We're going to have a short break, and in that break, if you'd like to, during your break, if you'd like to, make sure you do, use the refreshments, tea, coffee. Do give yourself that sort of self-care as well, and then also get the opportunity to go and look at these stands, meet these amazing, wonderful services and organisations, and then we'll come back and we'll have the open mic session. Thank you very much, everybody. Did you enjoy that? Did you have a good break? Are you all feeling ready for the next session? Okay, so this is the next part of the Care and Share, where we call it the open mic. This is where I hope I've got some volunteers who would be happy just to share about a service that they have met today that they didn't know about already. We've literally got 10 minutes to do this, so we'll have to rush through it. First of all, what we're going to do is bring the mic to you, so if you could stand up and talk about a service that you did not know about before today and how brilliant they are. So first of all, any volunteers, any hands up? There's got to be one. Brilliant.
Hi everybody, my name is Sandra Ward. So it's great to be here today. I'm a sandwich carer for my daughter and for my elderly parents. And one of the first people I met, who I hadn't met before, was Vicky. And it was really good to talk to Vicky about the work she does. And then, on another note, I said to Vicky, did she know about the Carers Partnership Board in Cornwall? And she said no. So I'm the chair of the Carers Partnership Board, which is a board that's made up for all carers, so carers of children, carers of husbands and wives and elderly parents. So we represent... Oh, did I just come in? Did you hear what I said before? Sorry about that. So what it's about is hearing views, sharing stories, and also shaping services for carers in Cornwall. So if any of you here today would like to join and get to know about the Carers Partnership Board, come and talk to me. Or you can email Healthwatch Cornwall, who do the administration for all the partnership boards in Cornwall. So the others being older persons, learning disabilities, autism and mental health. So please do get involved in shaping services in Cornwall. Thank you.
Anyone else would like to share about a stand that they've met today?
Here we go. So I'm Helen, I'm the Hospital and Community Manager in the Isles of Scilly, and although I've been an Admiral nurse in the past, so I'm just seeing lots and lots of really familiar faces, it's been really good to re-meet lots of you and look at how actually we can work together and bring services to support our families in the community on the islands a bit better. We're in the middle of a brand new integrated project, so lots of exciting things going on. The care home is moving up to the hospital and all kinds of things. So I'd love to meet lots more of you in a bit. What services have I met today? I have met the FILO project and Sensory Trust. I'm really hoping we can work more closely with them. And there's lots of us. Oh, and research as well. Lots more.
Thank you. And we've got someone else, another volunteer.
I'm Caroline from the Chaos Group. So I have met Laura Verco today from the research team, and I feel quite excited about some work that we can hopefully do together. Also meeting the FILO project, who I have some awareness of, but it was really good to meet them and link today. So thank you.
Lovely, thank you.
Thanks. Hi, I'm Sophie from Shared Lives Southwest. I'd already met Charlotte at Carers Corner, but I met Jude from the FILO project again. And I just find, I found that their work really ties in with the opening talk that was done about connection and emotional maturity or emotional connection with people. And I just really enjoyed hearing more about it because Shared Lives and the FILO project are very similar in the work that they do. So, thanks.
Thought we had a hand over there. Am I right? No. Was there a hand there? No. Okay.
I don't like it.
Is there a hand?
Hello, I'm Kate from Cornwall Carer Service again. So I think it wasn't the break, it was before the break, so I'm cheating. So I met the fire brigade lady over there who I refer to, but I managed to go over and have lots of conversations with her as to what's available for people, especially when they live in their home, they're hard of hearing and they need support with fire alarms. And also that one thing I didn't know is, and she'll probably give you a lot more information about it, when people struggle to get out of their property, you can refer to them and they'll go do a fire safety, but also they'll flag them. So if they know if they hear of a fire at that property, they'll also recognise it and respond and understand that people can't get out. And they've got loads of equipment. So there you go.
Wonderful. Okay, well, I think that probably draws us to the end of this presentation. I really hope that you got a sense of how the Care and Share events run. It's been a real privilege, and thank you again for inviting us to be here today, and I really hope you enjoy the rest of the day. Thank you.
Oh, we've got one more, look. We've got one more, Caroline, one more volunteer to share this. There we go, to join Karen so you don't feel so left out. Give Alison a round of applause.
Thank you.
I didn't manage to go around to any of the other services, unfortunately, because people were trying to rugby tackle me to the floor to talk to me. But I'm just to let you know about us. I'm Alison O'Kelly. I'm the Advanced Clinical Practitioner for the Cornwall Memory Assessment Service, which is where most people have their first contact with the dementia services. We've got 8 teams across the county. We assess, we diagnose, and we treat where possible. We have got very skilled clinicians. A lot of us can now refer for CT head and MRI scans. We prescribe medication for dementia as well. We work closely with the PCDPs in the north and east. We'll often do joint post-diagnostic support clinics so that the person gets to know their support worker, PCDP, at an earlier stage. Next year, we'd love to do a CFT presentation about the community mental health team services and how we all fit together and what we do, maybe producing some sort of pathway flowchart so people can see where it all fits in. But a newer initiative that we have is MAS GPs, which Alison will talk about because it's her baby. Thank you.
Well, I'm not quite sure how I've got landed with this because I will introduce Dr. Dan Kingston, who's hiding at the back, who ran off and got out of this. But along with the fantastic clinicians working in the memory assessment service, you've got nurses, you've got psychologists, some psychology team here today, you've got fantastic occupational therapists, consultant psychiatrists. There's one over there actually hiding, not looking at me. There's two, hello, yeah. So there's a whole team of people that help in the memory assessment service. But a more recent addition for Cornwall was also some general practitioners with a sort of extended, sort of another sort of role to sort of skill up to sort of help in kind of diagnosis. Dan, who's hiding at the back, is one of those GPs who's got an extra sort of interest, particularly focusing on people that might miss out on a traditional route of referral, so those with frailty or in a care home, really. But and I've also been helping in the usual clinics for memory assessment, just a fantastic, enthusiastic bunch of clinicians, really expert and really kind of skills. It's a privilege to kind of work with you all. We know that we still don't have, we think there are just under 10,000 people estimated to be living with dementia in Cornwall. At the moment, figures are near sort of 6,000. Not everybody comes forward for a diagnosis. We are seeing that improve. We're trying to get away from the myths and the stigma and break down the barriers for a diagnosis. We know that a diagnosis is what unlocks the key to the sort of support and some of it that you've mentioned here today, really. So a shout out to my memory assessment colleagues. Thank you to Alison. And the way this conference works, you're now realising, is that we rope in people for next year's conference. So, yeah. Table over there, you're absolutely up here. So there's, speakers we want for next year. If you have an idea what we should do, any volunteers for chairing, we'll sort of snap you off. So it's really hard to come up here and speak. So thank you to everybody and to Caroline and the open kind of mic group and the sharing care.
Our email address if they need any information about the two. There's our email address. So if anybody would like more information about the Care Share or the Supporting Ahead programmes, please do give us an email.
Round of applause for everybody. Thank you.